You probably think American healthcare is expensive because of innovation or quality, but the real data tells a much darker story. Behind the scenes, a complex web of hidden incentives and middleman markups ensures your medical bills only move in one direction. We are pulling back the curtain on the secret economic engine that profits from every single price hike you see. First, consider the administrative arms race. If you walk into a hospital, you would assume most of the staff are there to heal patients. In reality, administrative staff outpace actual doctors by 10 to 1. Billing has mutated into a specialized bureaucratic battlefield where hospitals use a secretive document called the charge master to set completely arbitrary sticker prices. A single Tylenol pill is listed for $15 just to give the hospital maximum leverage when negotiating private discounts with insurance companies. Even the recent push for AI automated coding has backfired. Hospitals now use aggressive AI to scan patient files and automatically upcode diagnoses to the most severe, highest-paying options, while insurers build rival AI systems to deny them. It's a multi-billion-dollar tech war funded entirely by your premium hikes. Then there's the middleman markup. Invisible corporations called pharmacy benefit managers sit directly between drug makers and pharmacies, quietly pocketing billions in hidden rebates. This creates a vicious cycle known as the rebate trap. Because these middlemen make their money on a percentage of a drug's total list price, high-priced brand name medications yield the biggest margins. As a result, they actively sideline cheap generic medications and kick them off approval lists completely. When drug companies must artificially inflate their prices just to pay off these corporate middlemen, it creates a floor for medical costs that can never be lowered. We are told that a free market drives down costs, but healthcare is a regional monopoly. Massive hospital consolidations have quietly eliminated competition in 90% of U.S. metropolitan markets. Through vertical integration, corporate healthcare giants buy up independent local clinics and immediately hike prices by 300% for the exact same routine services performed in the exact same building. Recent price transparency laws failed because transparency is completely useless without choice. If a single corporate monopoly owns every emergency room within a 2-hour drive, knowing the price beforehand doesn't give you power, it just gives you an advance warning of your financial ruin. Compounding this is the core engine of the medical economy, the outdated fee-for-service model. This rewards providers for the quantity of procedures, tests, and scans they perform, rather than the quality of your long-term health. To avoid catastrophic lawsuits, doctors routinely practice defensive medicine, ordering an estimated $200 billion a year in completely unnecessary testing just to create a protective paper trail for the courtroom. The system structurally punishes efficiency. Keeping a patient well makes very little money. Treating a chronic illness over a lifetime generates millions. So why do Americans tolerate this? Because the true cost is hidden in the employer-sponsored insurance trap. Workplace health benefits are tax-exempt, which completely blinds consumers to the decay of their purchasing power. For 2 decades, hyperinflated premiums have acted as a parasite on middle-class income. Real cash wages have stagnated precisely because every single dollar that would have gone toward a pay raise has been cannibalized by rising corporate health premiums. Because the United States lacks a unified public option or a centralized entity with the bargaining power to dictate and cap prices, the individual consumer is left entirely exposed to exploitation. The system is not broken. It is operating beautifully for the monopolies, the middlemen, and the administrative armies that rely on your bills staying high to keep their profits growing.